Morning everyone, I am Dr. Adithi and I am presenting a case report on the enigma of post-keratoplasty localized bleed. Patient was a 23-year-old male, known case of keratoglobus with no systemic illness. He presented to our center with history of pain, redness, watering and diminution of vision in right eye. On examination, we found a large 9 into 10 mm corneal ulcer. Patient underwent therapeutic keratoplasty using a large graft of 11 mm and the culture report of the infected tissue showed fusarium keratitis. 2 months post-operatively, patient presented to our center with a complaint of sudden bleed in the eye. There was no history of trauma to the right eye. On examination, there was a localized bleed in the temporal part of the graft. The temporal part of the graft contains sclera since it was a large graft and a part of the donor sclera was included in the graft. And the bleed was restricted only to the sclera and did not cross the corneoscleral junction. Section through the bleed did not reveal much details due to posterior shadowing. The patient was managed conservatively and the bleed resolved over the next month. You can see in the clinical picture that the bleed has completely resolved and we can see the part of the sclera of the donor tissue. ASOCT on the last follow-up showed, you can see in the lower arrow showed the descemet membrane, while the upper arrow shows the graft host junction. We can see that the thickened descemet membrane is not reaching up to the graft host junction, which further confirms the presence of the scleral tissue. So to discuss the possible cause and why it was localized, we need to know about the anatomy of the cornea and the sclera. The collagen fibrils in the corneal stroma have a uniform diameter of 25 to 35 nanometer and they are arranged regularly in a lamella pattern. Whereas in the sclera, they have a wide range of diameters ranging from 25 to 230 nanometers and they have a random arrangement in bundles and are separated by large empty spaces. Any microbleed may have then progressed through the scleral tissue but could not cross into the cornea because of the tight lamellar arrangement. To the best of our knowledge, this is the first such reported case of bleed in a large graft involving donor scleral tissue. These are the references. Thank you.
You had bleeding in the sclera part.
Only in the scleral part, sir, yes.
Then why you were worried about that bleeding?
We were not worried, sir. We just managed conservatively. We just wanted to report that this is the first such case which we have seen.
About bleeding in the
Scleral,
graft.
only, yes, sir.